10 early symptoms of colon cancer many people overlook. Most people believe that colon cancer always announces itself with obvious, bright red blood in the stool. That belief is one of the most dangerous misunderstandings in modern health awareness, because in many early cases, there is no visible blood at all. The changes are quieter than that. They hide inside routine habits, minor discomforts, and small shifts in energy that most of us are trained to dismiss. This video is for educational purposes only. It is not intended to diagnose any condition, recommend any treatment, or replace the guidance of a qualified healthcare professional. If anything you hear today sounds familiar, the most important next step is a conversation with your doctor, not a conclusion drawn from a video. Colon cancer is one of the most common cancers diagnosed worldwide, and it is also one of the most treatable when caught early. That single fact is worth sitting with for a moment, because it means awareness itself can be a form of protection. Unlike some cancers that develop and progress with very little warning, colon cancer often grows slowly, sometimes over the course of many years, starting as a small, usually harmless growth called a polyp on the inner lining of the colon. Not every polyp becomes cancerous, and most never do, but the ones that eventually change tend to do so gradually. That slow timeline is actually good news for anyone paying attention, because it means there is often a window, sometimes a long one, where the body is quietly sending small signals before anything more serious develops. The challenge is that these signals rarely look like what people expect. Television and movies have taught us to picture cancer as something sudden and dramatic, announced by a single unmistakable symptom. Real life is usually far quieter than that. The body tends to whisper before it shouts, and those whispers are easy to miss when they show up disguised as everyday inconveniences, a bit more tired than usual, a stomach that feels slightly off, a bathroom routine that has shifted without any clear reason. Throughout this video, we will walk through 10 signs that are frequently overlooked, misread as something minor, or brushed aside entirely. Some of them will sound familiar right away. Others will surprise you. And there is one sign near the end of this list that doctors say is mentioned far less often than it should be, even though it can appear months before anything else does. Stay with us, because that one alone may change how you think about your own body. Number 1. Unexplained changes in bowel habits. The digestive system tends to follow a rhythm, and most people know their own rhythm without ever thinking about it consciously. When that rhythm shifts for no clear reason, and stays shifted for more than a couple of weeks, it deserves attention. This can look like diarrhea that will not resolve, constipation that feels new and unfamiliar, or an unpredictable alternation between the two. It is easy to blame stress, a new diet, or a recent illness, and often those explanations are correct. But when a change in bowel habits lingers well beyond what a stomach bug or dietary shift would normally cause, it may indicate that something inside the colon is affecting how waste moves through it. A growth, even a small one, can partially narrow the passage or irritate the lining enough to disrupt a pattern that has otherwise stayed consistent for years. Consider Robert, a 61-year-old retired mail carrier, who noticed that his once predictable morning routine had become unreliable over the course of about 6 weeks. He assumed it was related to a new blood pressure medication. It took a conversation with his doctor, prompted mostly by his wife's concern, to look further. Not every case unfolds this way, and most changes in bowel habits have far more common explanations. Still, persistence without a clear cause is the detail worth paying attention to. What makes this symptom particularly tricky is how easily it blends into ordinary life. Many adults already experience mild digestive fluctuations tied to travel, medication changes, or seasonal shifts in diet, so a new pattern rarely raises alarm right away. The key distinction doctors point to is duration paired with a departure from what has been normal for that specific person. A single week of looser stools after a stomach virus is not unusual. A bathroom pattern that has quietly shifted and stayed shifted for a month or longer, without any obvious trigger, is the kind of detail worth writing down and bringing up at your next appointment, even if it feels minor in the moment. Number 2, blood in the stool that is easy to miss. When people picture blood as a warning sign, they often picture something dramatic and unmistakable. In reality, blood associated with early colon changes is frequently subtle. It may appear as a dark, almost black discoloration rather than bright red. It may show up only occasionally, easy to attribute to hemorrhoids or a minor irritation. It may even be invisible to the eye entirely, detectable only through a laboratory stool test that checks for microscopic traces. This is part of why routine screening matters so much, because it can catch what a casual glance in the bathroom simply cannot. Hemorrhoids are common and are usually the true explanation when blood appears, but the only way to know for certain is to have it evaluated rather than assumed. A pattern that continues, changes in color, or blood that appears alongside other symptoms on this list is worth mentioning to a healthcare provider, even if it feels like an uncomfortable topic to bring up. Patricia, a 57-year-old office manager, noticed a small amount of dark discoloration on 2 separate occasions over the course of a month, and initially assumed it was related to a spicy meal or a minor internal irritation. She almost did not mention it during her annual checkup, embarrassed that it might sound like an overreaction. Her doctor encouraged her to view it differently, explaining that reporting small physical changes is never an overreaction. It is simply good information that helps guide the right next steps. This is a sentiment worth carrying with you long after this video ends. Doctors are not looking for dramatic symptoms to take a concern seriously. They are looking for accurate, honest information, and even the smallest detail can matter more than it seems. Number 3, persistent abdominal discomfort or cramping. Everyone experiences the occasional stomach ache, and most of the time it passes within a day or two, tied to something eaten, a stressful week, or a minor bug going around. The discomfort worth paying closer attention to is the kind that keeps returning, especially if it centers in one particular area of the abdomen and does not fully go away with rest, hydration, or over-the-counter remedies. This discomfort may be described as cramping, a dull ache, or a sensation of pressure that comes and goes throughout the day. Dorothy, a 73-year-old grandmother from a small town in Ohio, described her early symptom as a feeling that something was simply not sitting right, low in her abdomen, for nearly 2 months. She had managed chronic mild indigestion for years and initially dismissed it as more of the same. What made her eventually seek care was not the intensity of the discomfort, but its refusal to follow the pattern she had come to expect from her usual digestive issues. Persistent, unexplained abdominal discomfort is a signal that the body is asking for attention, even when the sensation itself feels mild. It also helps to pay attention to timing. Discomfort that consistently appears after eating, that worsens throughout the day, or that interrupts sleep on a regular basis carries more weight than discomfort that comes and goes randomly without any pattern at all. Keeping a simple mental note, or even a written log, of when the discomfort shows up and how long it lasts can be genuinely useful information to bring to a doctor's appointment. It transforms a vague complaint of feeling not quite right into something specific and actionable, which often leads to a faster and more accurate evaluation. Number 4, feeling like the bowel does not fully empty. This particular sensation has a clinical name, tenesmus, which simply means the feeling that a bowel movement is incomplete even immediately after using the bathroom. It can be uncomfortable to describe and even more uncomfortable to bring up in conversation, which may be part of why it goes unmentioned so often. This sensation can occur when something is physically present in the lower colon or rectum, creating pressure that mimics the urge to go again almost immediately. It is different from ordinary constipation because the discomfort persists even after a movement has already occurred. If this feeling becomes a regular part of your daily experience rather than an occasional one, it may be associated with a structural change worth discussing with a doctor. Many causes of this sensation are benign and treatable, including inflammation or irritation unrelated to cancer. But distinguishing between possibilities requires an actual examination rather than guesswork. Because this symptom sits in such a private part of daily life, it is often the last thing people bring up, if they bring it up at all. Some patients live with it for months, quietly adjusting their routines around it, before ever mentioning it to a doctor. Healthcare providers frequently note that patients apologize before describing this symptom, as though it is somehow inappropriate to discuss. It is not. It is simply physical information, no different from describing a headache or a sore knee, and it deserves the same straightforward, judgment-free conversation. Number 5, unexplained fatigue. Fatigue is one of the most underestimated symptoms in all of medicine, largely because it has so many ordinary explanations. Poor sleep, high stress, a demanding job, or simply getting older can all produce tiredness that has nothing to do with cancer. What sets concerning fatigue apart is its persistence and its resistance to rest. This is exhaustion that does not lift after a full night of sleep, that shows up even during periods of normal activity, and that cannot be traced back to any obvious lifestyle cause. In the context of colon health, this kind of fatigue is sometimes connected to slow, ongoing blood loss inside the digestive tract, a loss so gradual that it produces no visible symptoms of its own, yet slowly reduces the body's oxygen-carrying capacity over weeks or months. Harold, a 68-year-old former high school teacher, described feeling like he was walking through his days with a kind of heaviness he could not explain, despite sleeping 8 hours a night. He attributed it to age until routine blood work revealed something that prompted further investigation. Fatigue alone rarely points to one specific cause, but fatigue that persists without explanation deserves a conversation with a healthcare provider. One reason this symptom is so easy to overlook is that it develops gradually rather than arriving all at once. A person does not usually wake up one morning suddenly exhausted. Instead, the tiredness accumulates slowly, week after week, until it becomes the new normal without anyone noticing the shift. Family members are often the first to comment, saying something like, "You seem more tired lately. Are you feeling okay?" Precisely because they are comparing the person to how they were months earlier, a comparison the person themselves rarely makes in the moment. If someone close to you has mentioned a change in your energy recently, it may be worth taking that observation seriously rather than brushing it aside. Number 6, unintentional weight loss. Losing weight without trying is one of those symptoms that sounds almost pleasant on the surface, until you consider what causes it. When the body loses a meaningful amount of weight, generally more than about 5% of total body weight over 6 months, without any change in diet or exercise, it may indicate that something is disrupting normal metabolism, digestion, or appetite regulation. In the context of colon health, this can happen when a growth affects how nutrients are absorbed, or when the body redirects energy toward fighting an internal process the person is not even aware of. This kind of weight loss tends to feel different from weight loss achieved through effort. Clothes fit looser without a diet change. The number on the scale drops steadily rather than fluctuating. Family members often notice before the individual does, commenting on a changed appearance during a holiday visit or a phone call after months apart. Unintentional weight loss is rarely something to dismiss as good fortune, and it is one of the clearer signals that the body is asking for a closer look. There is a particular kind of denial that tends to surround this symptom, because losing weight is so often framed as a positive outcome in our culture. It can feel counterintuitive to treat a lighter number on the scale as a warning sign rather than a small victory. Doctors emphasize looking at the full picture rather than the number alone. Ask yourself honestly whether the change matches any effort you have made. If your eating habits, activity level, and daily routine have stayed essentially the same, yet your weight continues to drop, that mismatch between cause and effect is the detail that matters far more than the weight loss itself. Number 7. Narrow or ribbon-like stools. This is a symptom that many people notice, but few feel comfortable mentioning to anyone, including their own doctor. A change in stool shape, particularly a narrowing that looks different from what has been typical for that individual, can occur when something inside the colon is partially obstructing the passage. This is not the same as an occasional variation, which happens naturally based on diet and hydration. The concerning pattern is a consistent, repeated narrowing that continues over multiple bathroom visits across several days or weeks. Because this symptom feels embarrassing to discuss, it is one of the most commonly delayed reports in early evaluations, sometimes going unmentioned for months. Doctors emphasize that no detail is too small or too awkward to share, because these small physical clues are often the ones that lead to an earlier diagnosis and, in many cases, a more favorable outcome. It can help to think about this symptom the way you would think about a change in your handwriting or the sound of your own voice, small physical signatures that stay remarkably consistent over a lifetime unless something is actively influencing them. Because stool shape is something you observe privately, several times a day, you are actually in a better position than almost anyone else, including your doctor, to notice a genuine change from your own personal baseline. That makes you the most important observer of your own health in this particular case, and sharing what you notice, however awkward it may feel, is one of the simplest and most effective things you can do. Number 8. Iron deficiency anemia discovered through routine blood work. Sometimes the earliest sign of a colon issue is not something a person feels at all, but something a doctor sees on a lab report. Iron deficiency anemia in adults, particularly in men and in women past menopause, is considered worth investigating further, because unlike younger women, these groups do not have an obvious, expected reason for low iron levels such as menstruation. When anemia shows up unexpectedly in this population, doctors often recommend checking the digestive tract for a source of slow, hidden blood loss. Betty, a 65-year-old retired nurse, only discovered her anemia during an annual physical exam. She had no symptoms she would have described as concerning on her own, aside from feeling a bit more tired than usual, which she attributed to her grandchildren visiting for the summer. Her case is a reminder that not every warning sign announces itself through discomfort. Sometimes it shows up quietly, in a number on a page, waiting for someone to ask why it is there. This is also a strong argument for keeping up with routine blood work, even when you feel perfectly well. Iron deficiency anemia develops slowly, often over many months, as the body gradually loses more iron than it can replace through diet alone. By the time a person feels noticeably fatigued or short of breath from anemia, the underlying cause may have been present for quite some time already. A simple annual blood panel can catch this shift long before it becomes symptomatic, which is exactly why routine checkups matter, even for people who consider themselves generally healthy. Number 9. Excessive gas or bloating that does not go away. Everyone experiences gas and bloating from time to time, and for most people, it is tied to specific foods, carbonated drinks, or simply eating too quickly. The pattern worth paying attention to is bloating that becomes a near-constant companion, unrelated to what was eaten, and accompanied by a sense of fullness that does not match how much food was actually consumed. This can happen when a partial blockage in the colon changes how gas and waste move through the digestive system, creating pressure that builds throughout the day rather than resolving after a normal bowel movement. Walter, a 59-year-old accountant, described feeling like his stomach was permanently distended for nearly 2 months, despite no change in his diet or weight in other areas of his body. He assumed it was related to stress during tax season. Persistent bloating, especially when paired with any other symptom on this list, is worth mentioning during a medical visit rather than managing quietly with over-the-counter remedies. Bloating is one of the most commonly self-treated symptoms in existence, largely because antacids, digestive enzymes, and probiotics are so widely available and often provide at least partial relief. That partial relief can unfortunately delay a proper evaluation, because it creates the impression that the issue is being managed even when the underlying cause has not been identified. If you find yourself reaching for the same over-the-counter remedy week after week without ever really solving the problem, that pattern itself is useful information. It suggests the bloating is being masked rather than resolved, and it may be time to ask a doctor what is actually causing it in the first place. Number 10, a vague, nagging sense that something is wrong. This final sign is the one many doctors say is mentioned least often, and yet it is one of the most consistently reported feelings among people later diagnosed with early-stage colon cancer. It is not a specific symptom in the traditional sense. It is a general, hard-to-articulate feeling that the body is not functioning quite the way it used to. Patients describe it as an intuition rather than a diagnosis, a low hum of unease that does not match any single complaint on a medical chart. Margaret, a 70-year-old former librarian, put it simply during a follow-up appointment. She said she just knew something felt different, even though she could not point to one clear symptom that explained it. It took persistence on her part, and a doctor willing to listen closely, to trace that vague feeling back to something concrete. Medical research increasingly supports what many patients have long suspected, that the body often signals distress in ways that are not easily measured, well before more definitive symptoms appear. This is not a call to panic over every fleeting worry, but rather a reminder to trust a persistent, unexplained instinct enough to bring it up with a healthcare professional, rather than dismissing it as anxiety or overthinking. What separates this feeling from ordinary, everyday worry is its persistence and its specificity. Everyday anxiety tends to attach itself to particular stressors, a deadline, a family conflict, a financial concern, and it typically eases once that stressor resolves. The kind of unease we are describing here is different. It lingers regardless of what else is happening in a person's life, and it tends to center, however vaguely, around the body itself rather than external circumstances. Patients often describe it as simply not feeling like themselves, in a way that is difficult to put into words but impossible to fully ignore. If you have been carrying a feeling like this for weeks or months, it is worth naming out loud to a doctor, even if you worry it sounds unclear or even a little irrational. Doctors hear this kind of description far more often than most people realize, and they take it seriously. None of these 10 signs, taken alone, confirms anything. Bowel habit changes, subtle blood, abdominal discomfort, incomplete emptying, fatigue, weight loss, narrow stools, unexpected anemia, persistent bloating, and that quiet sense that something is off. Each one has dozens of far more common and far less serious explanations. What matters most is not any single symptom in isolation, but persistence, combination, and change from what has always felt normal for you. Colon cancer remains one of the most treatable cancers when identified in its earliest stages, and that single fact remains the most powerful reason awareness matters as much as it does. If anything in this video sounded familiar, the most useful thing you can do today is not to worry alone, but to talk to a healthcare professional who can properly evaluate what you are experiencing. Screening guidelines have also shifted in recent years to recommend earlier testing for many adults, so it may be worth asking your doctor whether you are due for a colon health screening, regardless of whether you have noticed any symptoms at all. It is worth repeating the most important point from this entire video, because it is the one statistic that matters more than any other. When colon cancer is identified and treated in its earliest stages, the outlook for most patients is significantly more favorable than when it is caught later. That single fact is the reason awareness like this matters, not to create fear, but to shorten the distance between noticing a change and acting on it. Screening tools available today, including at-home stool tests and colonoscopy, are more accessible and more comfortable than many people expect. And for most adults, Screening can begin well before any symptoms ever appear at all. Think back over the 10 signs we covered today. A shift in bowel habits that will not resolve, blood that is easy to miss, discomfort that keeps returning, a sense of incomplete emptying, fatigue that will not lift, weight loss without explanation, a narrowing in stool shape, anemia discovered by accident, bloating that lingers, and finally, that quiet, persistent feeling that something is different. None of these signs alone tells the whole story, but together, they form a picture worth paying attention to and worth discussing openly rather than carrying silently. We would love to hear from you in the comments. Has anyone in your life experienced a symptom like the ones we covered today, one that turned out to be more significant than it first seemed? Sharing those stories helps other viewers recognize signs in themselves or in someone they love, sometimes early enough to make a real difference. If you found this video helpful, consider sharing it with someone who might need to hear it, and if you would like more educational content like this, subscribing helps us keep making it. Thank you for spending this time with us, and take care of yourself.